and welcome everyone. I am Rachel, Community Manager here at Alloy Women's Health. We are a digital health platform bringing science-backed, evidence-based menopause hormonal solutions direct to your door. Today, once again, I am so pleased to welcome back to the platform Dr. Vonda Wright, a double board certified orthopedic surgeon, authority on active aging, author of 5 books. Dr. Wright specializes in minimally invasive surgery, hip preservation, shoulder and knee reconstruction, cartilage restoration, and injury prevention. In addition to her surgical practice, Dr. Wright is an accomplished researcher and author who speaks worldwide and develops innovative programs for optimizing performance and minimizing injury. Dr. Wright also hosts the podcast Hot for Your Health. Her work focuses on optimizing performance at every age, particularly in menopause and beyond. Before we get into things, I want to invite you to take advantage of today's code, which you might have seen on the banner. It is RIGHT25 over on myalloy.com, and enjoy $25 off any purchase. And finally, I want to invite you to drop your questions for Dr. Wright into the Q&A. I will facilitate those for you as we go on this hour. Welcome back to the platform, Dr. Vonda Wright.
Hi.
Hi, it's so nice to see you, always. You talk about the musculoskeletal syndrome of menopause. Can you please explain what this syndrome is and how it impacts women during menopause?
So I see patients on Mondays, Tuesdays, and Thursdays, and every clinic, as I'm scaling down my list, I'll see a 46-year-old woman coming in with shoulder pain. And before I even go in the room, I know that there is a high likelihood that when I get in the room, she's going to say, I didn't do anything. I don't know what happened, but this pain is worse than childbirth. Can you please help me with the fact that my shoulder doesn't move? And she'll do something like this if you're watching.
Yeah.
She's trying to raise her arm and she
Yeah.
can't get to her head. And this woman has frozen shoulder. And so when we talk about the musculoskeletal syndrome of menopause, frozen shoulder is one of the most common things that people may be aware of. Oh, I don't know what happened to my shoulder. But the fact of the matter is that there are estrogen receptors, meaning the little baskets that estrogen, when it's circulating around your body, fits into on every tissue of the body, the brain, the bones, the muscles, the heart. And so when we think of hormone replacement therapy as something that's only good for hot flashes, night sweats, and brain fog, we're leaving out about 93% of all the other amazing functions of estrogen. And so, just like all the other tissues, the musculoskeletal tissues, which for a review, it's been a long time since biology class, probably for many people, muscles, tendons, ligaments, bones. I count inflammation as part of the things that affect the musculoskeletal system. Cartilage, which is the smoother than ice lining of the bones, and fat, which we love or don't love. And so those tissues all are responsive to estrogen. And so the musculoskeletal syndrome of menopause, finally, I'm getting to it, are the 6, or I wrote about 6 of them in the recent paper, but there's more and more and more. Total body pain, which is called arthralgia, which was one of my main perimenopause problems, was I'm an athlete and I couldn't get out of bed. Well, I did get out of bed, but it was painful to walk around for no reason. So arthralgia, frozen shoulder, like so many women coming into my clinic have, those are due to inflammation. Estrogen is a critical anti-inflammatory in the body. Next, we have loss of bone. People know this, and yet we do nothing about it. Bone is dependent on estrogen and testosterone for its health. And so when estrogen walks out the door and never looks back, we can lose 15 to 20% of our bone density within that 5-year period surrounding menopause. It's critical. Loss of muscle mass. We get weaker and lose our muscle around the time of menopause. Now, it doesn't mean we can't build it back. We can actually, but we'll lose it if we do nothing. We also have a rapid progression of arthritis. Arthritis is the loss of the cartilage matrix that lines the ends of our bones. Before 50 years old, men have more arthritis, but at 50, women have a rapid progression such that for 30 years, it's been described as the arthritis of menopause, and yet very few people know about it, right? And then
Absolutely.
finally, we have, I mean, we can, before I forget it, it popped into my head. I didn't write it into the paper, but this a pandemic almost of low back pain that happens in this country,
Yes.
part of it is due to the loss of estrogen in the discs that separate our spinal vertebrae. They dehydrate, they become less cushiony, they collapse, contributing to our shrinkage, right? Lots of women get
Yeah.
shorter as they get older. And that's not just because of bone collapse, it's because of spinal disc. And then finally, we get a redistribution of fat from the periphery to our bellies. Nobody loves it, but that's another role of estrogen. And listen, people, fat is not just inconveniently hanging off of places we rather it wouldn't. Fat is a noxious metabolic organ that produces cytokines that can kill us. And so it behooves us to get our body composition under control.
Thank you, Dr. Wright. That's incredible. I am thinking as you're, sorry, there was this awkward pause. I was just thinking about sort of the cascade of loss, the increase of pain as a result of the depletion in estrogen. So there's muscle, bone, joint, tendons, ligaments, cartilage, fat, that's all affected. Bone density is affected. What are some of the steps? Just, I know we're going to get into it a little bit, but just some of the steps that women can take to preserve or improve their bone health. So many women, I'm thinking of many of us sort of late in perimenopause or just in menopause, and all of a sudden the back is hurting. Maybe we've had this arthralgia for a while, which I'd like to talk about some more. But before we sort of get to that, what are some of the things women can do?
To preserve our bone?
Mm-hmm.
Well, first let's answer the question, why do we want to preserve our bones? Why is that important? Here's why it's important. Well, you may not know it. Maybe this is the first time you're ever going to hear this. Bone is not just structural. Bone is an endocrine organ secreting amazing proteins that go to all different parts of our body and tell it what to do. There is a cytokine released by the osteoblasts, the building part of bone, called osteocalcin. One of the things it does is goes to your brain and helps your brain produce neurotrophs to build better brain. Part of it goes to the pancreas and muscle to help regulate glucose metabolism. If you're a man or care about a man, it also goes to the testicles and makes testosterone. So bone is an amazing endocrine organ. Start talking about that with your friends because you probably never
I had no idea.
I know. But bone is also structural. There's a lot of emphasis right now on building muscle, and thank God that's the truth. But the fact of the matter is, without bones, muscle is just a quivering mass of tissue sitting there. With bones, you can move, you can run, you can function. So bones are structural. Bones are also the body's storehouse of minerals for every chemical reaction you need in the body. Your body needs calcium for all of its electrical reactions, its metabolism. So it is no wonder that the body is amazingly created to have bone from the top of our heads to the bottom of our pinky toe. And so there's a source everywhere of these amazing things. So what I've just done for you is give you the first step to take care of your bones, which is knowing about your bones. Stop ignoring your bones. In fact, let's do this. We've got these people listening for a little bit amount of time. I want you to notice your bones. Most of the time, all we notice is our beautiful cheekbones. Oh, look at our beautiful cheekbones. Listen, your chin's a bone, cool chin, right? But look at your collarbone. Your
Yeah,
collarbone is what gives you your statuesque, upright posture. Without collarbones, you'd be like this,
right.
all folded
Right.
in half. Collarbones. Look at your wrist. Look at, oh, our delicate wrists. That sticky outy thing is a bone. This is a bone. I mean, we just, it seems silly, but we never take the time to notice the beautiful structure that our bones give us so that we appreciate them more.
Mm,
So learn about them, notice them. How do we preserve them? Well, there are lots of ways, and I'm going to tell you now, but the number one way that you can preserve your bone elasticity, which is a key component in not breaking, when a woman falls and breaks her hip, which 70% of hip fractures are in women, 50% of the time you will not return to pre-fall function, and between 22 and 30% of the time you will die in the first year. So we don't want to break at any circumstance. Plus, it's painful. So we're going to learn about it. We're going to notice them. We are going to make our estrogen replacement decision. I believe that every woman is a sentient being with the ability to exercise her agency and make choices. Taking on estrogen as a way to save your bones and save your life in midlife is a choice. But I want you to make that decision based on science and not from fear, right? So that's the first choice you need to make. Replacing your estrogen has been found to prevent loss of bone density up to 50% and to prevent fractures 50 to 60%. It's a big deal,
yeah.
right? And as the world outside this webinar is debating the relative merits of estrogen for the brain and the heart, and should you this and should you that, there is no doubt,
Right.
there is no debate. Estradiol is FDA approved for the prevention of bone loss in midlife women. Done, right? So if I can save 50% of the female population of the world from a fracture by encouraging you to make your estrogen decision, that's the soapbox I'm going to stand on.
Awesome. Thank you so much.
Absolutely. What can you do from a lifestyle perspective? Number one, I want you, I've done a study that shows this. People ask me, what's the best exercise for building bone? Sorry, ladies, it's bashing your bone. It's jumping. We need to start a jumping practice, 10 minutes, 3 times a week, or 20 jumps a day. We need to turn the mechanical force of bashing your bones by running up the stairs, playing hopscotch, jump roping, doing jumping jacks. We need to turn the mechanical energy into biochemical energy that will build bone, because our bones respond to the strategic stress we put on them, right? So
Yes.
bash your bones. Now, if you have so much pain you can't do that, NASA, bless their hearts, we can trust NASA, right? NASA builds bones in their astronauts by having them jump on a trampoline when they first return from space. So you could always use a rebounder, which is a mini tramp. The next thing we must do for almost every reason under the sun is we must build muscle mass, right? Muscle, by being attached to bone, pulls the bone and provides a biomechanical stimulus to build more bone. So we need as much muscle as we possibly can for a variety of reasons, but also to build better bone. And finally, we must feed our bone. We need a high protein diet. 50% of bone is protein. High protein diet. We need enough vitamin D with K2 for absorption. We need 500 milligrams of magnesium a day. And if you want to get fancy, you could look up the role of strontium, of boron, or eating 6 prunes a day, as my 84-year-old mother likes to do. So, yeah.
Thank you so much, Dr. Wright. That's incredible. I often solicit questions for our guests in my feed, and I receive something like 12, maybe 15, 18, something like that, questions from women ahead of this conversation, specifically about frozen shoulder.
Oh, how
You
about that?
brought it up with the women who come into your office, and there's a 40-something-year-old and she can't move her shoulders and can't put on or take off her bra. And so you can put things together without even having seen her. But can you educate us a bit more on this particular condition and offer some solutions for us with regards to it?
So frozen shoulder, or 50-year-old woman's shoulder, which is what it's called in Asia, results from increased inflammation in the body as estrogen is not available to dampen down the effect of a chemical called tumor necrosis factor and a multifunctional molecule in the immune system called the inflammasome. So what happens is, for whatever reason, and we don't know exactly why, the shoulder capsule, which I'll define for you, is specifically susceptible to the inflammation caused by inflammation, period. Because men with diabetes can also get a lot of frozen shoulder, as well as women with diabetes, but it's an inflammatory response. So capsule, if you think of your shoulder as outside skin, underneath that, we can all pinch a little fat, right? Subcutaneous fat. Then all the cosmetic muscles, biceps, triceps, deltoids. Under those are the little rotator cuff muscles that lift our arm. And finally, surrounding our bones is a bubble of soft tissue called the capsule. The capsule is what becomes frozen. The capsule is extremely susceptible to inflammation, which frozen shoulder first presents with severe pain out of nowhere. You did not bump your shoulder on the closet in the middle of the night. You did not fall down. It's just all of a sudden it starts to ache, and sometimes by the next morning, it's excruciating. Well, then you do what is normal. You protect it. You hold it to your side. You don't move it because it doesn't hurt unless you move it. And within a few days, you'll come in with no motion because of the extent of the inflammation, which has caused the capsule to be painful to move, and therefore you won't move it. There are 4 stages of frozen shoulder that my mentor Joe Hannafin outlined in 2011. We've known these stages. It starts with pain and gradually goes through the stages of inflammation until the very last step is capsular contraction.
Mm.
So that you physically can't move it, not because of the pain anymore, but because the tissue itself has contracted. And the reason it can take up to 2 years to defrost, air quotes, defrost, is because of this contraction. Your body has to replace all that fibrotic tissue with healthy tissue. So what do you do about it? Number 1, the first time you feel it, you have to do something about it. The first thing to do is make your hormone replacement decision if you have not made it before. We know from a study done by Jocelyn Wittstein that women on estrogen replacement have lower incidence of frozen shoulder than women who don't. Number 1. Number 2, you have got to keep it moving. Your instinct is to rest it. That is the wrong instinct. Get to your physical therapist. Most physical therapists can see a patient 12 times before they need a doctor's order. So just go, move this arm, get it moving. Number 2, go see your orthopedic surgeon. It is very helpful in this instance when it is so painful to put a steroid injection in the shoulder. Now, I'm not a big fan of steroids, but in this instance, it can be incredibly helpful to facilitate moving in physical therapy. If we still have trouble getting it moving, the longer it doesn't move, the longer it's going to take to defrost, is to use something like platelet-rich plasma, which is your body's own growth factors that I harvest from your blood and inject it, because that is an amazing anti-inflammatory. Because what we're trying to avoid is taking you to the operating room and either manipulating you under anesthesia, which means moving it when you're asleep so it doesn't hurt, or making incisions to open this really tight capsule. We don't want to get
Wow.
there. I'm a surgeon, but I'd rather that not happen for you.
Sure.
Yeah, so that's
Thank
all
you.
the ways. Yeah.
Thank you for that. Dr. Wright, I'm going to turn to some questions that have come in now before I get back to our own here. Someone asks about soft tissue injuries. Are tears common in perimenopause? I've had a few tears, shoulder and knee, in the past few years. How do I prevent more?
Um, well, ligaments and tendons have estrogen receptors like every other musculoskeletal tissue. And so we see increased amounts of inflammation, which can lead to tearing, particularly in the plantar fascia of the foot,
Mm.
particularly in tennis elbow. And then we see a lot of associated rotator cuff inflammation. But sometimes, how do we even know your shoulder won't work, right? So that's
Right.
lumped into the frozen shoulder hit. So yeah, you can have a lot more increased tendon and ligament injuries. But that's another reason why we have to be concerned with building muscle, right? Tendon and ligament injuries happen more frequently when we're too weak around a joint and the tendons are being the mechanics aren't working as well because we're weak.
Interesting. Thank you. Another question is about a tucked tailbone. Could this issue be the reason for my pelvic issues and bladder prolapse? I don't know if that's quite in your
Uh,
wheelhouse.
I'm sorry, listener, I've never heard of a tucked tailbone. Is it broken? Is it under? But you know what? Bladder prolapse and pelvic floor dysfunction can happen because, listen, remember we lose skeletal muscle
Right.
around menopause? The whole pelvic floor, the basket that holds your guts in, your uterus in, is skeletal muscle. So the same way you lose biceps tendon, biceps mass and strength, you lose your pelvic floor, especially if we're not working out or supporting our pelvic floor, and then everything is stretched out from maybe years of being heavy or months of being heavy when we're carrying children. So all those play together. But you can rebuild the pelvic floor muscle wise. Kegels will never be enough, but there are great pelvic floor physical therapists that you can seek out.
Thank you. I have osteoporosis, says this listener. How much weight-bearing exercise and at what intensity do I need to protect my bones? I love this question. I was going to ask it of you later, but I love your answer in response to how much weight?
You want me to say, I know what you want me to say. So listen, when estrogen walks out the door, we no longer have the anabolic stimulus. Anabolic means growth, the growth stimulus to build muscle quite as well, or build bone quite as well. And so we therefore, when we're lifting to build muscle, must provide strategic stimulus at a level high enough to help our muscle building pathways, the mTOR pathway, build muscle. You cannot do that with mamby-pamby pink weights that you lift 30 times. It's garbage. Do not do that. Our goal is longevity and power. You can still lift weights with osteopenia. In fact, you must lift weights with osteopenia. You can even lift weights with osteoporosis. You just have to be careful and do it in a progressive way.
Mm.
So the way I prescribe lifting, no matter where you're starting, everybody asks me, well, how much is heavy? Well, heavy is different for you and for me. Um, it's different for every woman. Heavy means for the major compound lifts, what you can lift 4 times, 4 sets. We are not picking up, we are not pressing. This is a push for the upper body. We are not going to press a very lightweight 30 times. No, we are going to press a heavy weight 4 times. And what does that mean? Well, you press it 4 times. You could probably do one more, but after that, the bar is going to be all like this, dangerous. So that's what I mean by heavy. 4 reps, 4 sets. That is what will be strategic enough stress to build muscle while you're recovering. There is a study called the Lift More study, which showed that under careful supervision, even women with osteoporosis can safely lift heavy. It doesn't mean that you go from 0 to benching 150 pounds overnight. It means that you slowly progress. It takes time, but yes, you can.
Thank you so much. Someone asks about thumb arthritis that is
Oh,
now bone on bone. The
yeah.
pain has increased. It wakes her at night. She's researched surgeries. She's not optimistic. She's a nurse and she needs her thumb. She's 56 and she's assuming, she says, this is due to an estrogen drop. But what might your recommendation be? She's scheduled for cortisone injections.
So she's talking about either this joint or this joint, and that affects grip, right? It's hard to grip if
Mhm.
those joints are painful. So I have this because I'm a surgeon and I grip a lot. And it can be it can be primary. It can be you use the thing so friggin' much your entire career that you've developed arthritis. It can also be progressed by your lack of hormones. So those are two items. So what do we do about it? Well, you can get a steroid injection that will help temporarily. The literature says a couple weeks, but sometimes people get months and months. So you can do that. Another option would be platelet-rich plasma, which is very effective for arthritis. It can last a couple years.
Hmm.
But even if you decide to have this joint replaced, what you lose is powerful grip strength. But what you gain is function and being able to sleep at night. So, and you know, the operation for that is a funny little soft tissue operation. It doesn't take that long to get over, but it will affect your powerful grip.
Okay, thank you. Um, this person says, among zillions of menopause-related symptoms, are there any correlation between ethnicity and specific menopause symptoms, i.e., more bone loss slash osteoporosis in small Asian women, etc.?
I think
Anything
it's,
like that?
yeah, that's very interesting. I think um, Mary Claire Haver wrote a very nice summary of that recently on her webpage. But genetically, one of the risk factors for osteoporosis is the genes you're born with, number one, and it's also the activity you do as a youth. And
Mm.
so what we observe, and it's not a reason uh, for races that have less osteoporosis to ignore it by any means, but it is observed that small-framed Asian women have higher levels of osteoporosis at an earlier age. And that's partially due to genetic composition of their bones. It may be due to their activity levels. Um, And size, maybe the load put on bones. So it has been observed. And so it's another reason to ask yourself, is my mother shrinking? Am I shrinking? Have I ever had a fracture? Am I small and of a race that has younger and higher incidence of osteoporosis? But not just to observe it, to prompt action,
Right.
to educate yourself, to make your hormone decision because you can then prevent fracture better, to bash your bones and to build muscle.
Thank you so much for that. Um, Dr. Wright, just to sort of put a cap on the relationship between mobility and longevity, can you sort of just unpack for us quickly what role maintaining joint and bone health plays in longevity?
If you don't move, you die.
Thank you. There it is. There it is, everybody.
I once had an assistant, bless her heart, who had gotten this awful pattern. She would come in from the garage, she would park right on the floor. My office was on the 7th floor. She'd park on the 7th floor of the garage, walk a few hundred yards to her desk, sit down, and start ordering lunch. It was 8 a.m. in the morning, but that was the big conversation of the day. And I once had asked her to help me by going and getting something from another part of the hospital. And she says, "Doctor, I don't walk." And I don't
Mm,
think she was being sassy. I think she was being truthful. Well, what happened is that her health progressively declined and declined because the most movement she did any day was walking 100 yards from the garage to her desk seat where she sat at least 8 hours with me, helping me with my work every day. And she died a very proportionately young woman from sedentary death syndrome, which is the 33 chronic diseases that are directly affected by the amount of mobility or walking or moving, all the things we've talked about. And it's everything that you know of: heart disease, stroke, hypertension, Alzheimer's disease, cancer. 33 chronic diseases make up this little nomenclature, sedentary death syndrome. So that's why I so glibly said, don't move, or if you don't move, you'll die. It's because there's no question.
thank you so much. Can you give us sort of a quick little, I'm thinking about somebody who maybe isn't a big mover and is starting to feel things sort of around the body. Maybe she's overwhelmed by starting or maintaining a fitness routine. Um, you've told us about bone bashing, about lifting heavy, um, walking at the very least. Is there a kind of framework that you lay out for patients with regards to how much movement, what kind of movement, every day, every 5 days a week? What does it look like?
I think it can sound overwhelming. Once you start a few of these things and layer them on, it becomes a lifestyle that's not overwhelming at all. But I think if you're really stepping off the couch for the first time ever, maybe, or the first time since uh, we're thinking about once upon a time, um, it's okay. Actually, our bodies are designed to move. All of our strongest muscles are below our belly buttons. And so it's nature's most natural course to
Mhm.
move all the time. What's unnatural is not moving.
Right.
So the number one thing that you can do if you're just starting out is commit once a day after your biggest meal to go for a walk. And if all you can muster is 10 minutes, that's fine, because what you're going to do is you're going to shove all that glucose out of your blood into your muscles in 10 minutes. But what I would want you to do is invest in yourself every day for 7 days after your biggest meal. Go for a walk. It's going to clear your brain. It's going to shift your metabolism. And after 7 days, you are really going to feel like you have accomplished something, and you're not going to want to break the streak.
Mm,
Here's the
got
other
it.
thing. I need to assure you that if you take your walk after your biggest meal, say supper, you're at home having dinner, leave the dishes on the table. The dishes police do not come and arrest you. Nobody's judging you. You are more important than clearing the table. Go take your walk, come home, it'll still be sitting there, then you can clear the table.
Thank you. I'm seeing several questions about plantar fasciitis. Am I saying
Yeah,
it
good.
correctly?
Yeah,
Okay.
fasciitis.
Could you, I know you mentioned it already, could you share a bit more about it, what might be done, the role of MHT, anything like that?
So the plantar fascia is that tough band on the underside of your foot that goes from your heel to your toes. And lots of people get plantar fasciitis. It's usually due to calves, your muscles, and Achilles tendon that are too tight, or having no motion in your foot so that you can't dorsiflex, right? Your foot actually has to bend backwards to about here to be efficient. So what you're doing is you're stomping around. I'm hitting my desk right now. You're stomping around, which puts a ton of pressure on that tissue on the bottom of your foot. And so the first thing to do is to get your mechanics straight and to
Mm.
spend some time stretching and foam rolling. But again, it shows up in midlife because of the fluctuations in estrogen.
Right.
And so it's not a simple do this thing, it'll be gone. For instance, everybody wants a quick fix. Don't go just get a shot in it. It's going to come
Right.
back because it's due to mechanics. But do all the things, invest in your mobility. I think one of the things, we're a min-max society, meaning, and I get it, I'm a min-max person. I want the maximum benefit out of the minimum effort. Sometimes that's a pill. Sometimes that's a shot. That's never going to be sustaining until you change your lifestyle.
Thank you. I'm seeing also several questions about severe low back pain, hip pain. Again, sort of the relationship of MHT versus mechanical stretching. What can we do?
Um, I'm going to encourage everybody to go back and listen to the first 37 minutes of this because everything I have laid out for you will help those things. Can
Yeah,
it be associated with loss of estrogen? Yes. Can it be associated with the fact that you've lost muscle and you're not doing anything about it? Yes. Can it be associated with your vertebrae are becoming compressed because you're losing bone? Yes. So listen, I am unashamedly at this point challenging people to pivot from a victim mentality of, oh my God, this is the worst part of life. I was so great when I was 25 years old. 25 was easy.
yeah,
25 was not the greatest. It was just easy. There was a lot of problems in being 25. For me, I had no money. I still had decades of education to go, blah, 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 right?
25 wasn't so great for
It
everybody.
wasn't so great. We worship it. It's ridiculous. I'm encouraging everybody in midlife to pivot their mindset and invest in yourself in the way that can truly make this the life you envision because you know yourself. You have more control of your environment. Hopefully, we have more money. We're not living with our parents, but we can't live on the storehouse of our body that we laid down in the first 40 years. We have to reinvest every day. So I am frankly I love you guys, and it's not just this crowd. I love all the women I serve. But if we're going to give in to a victim mentality, the future will not be bright. If we recognize that this can be really, really, really tough, but then take all the steps that we talked about to
Yeah,
rebuild a new lifestyle, I'm telling you, this is the best time in my life. And I call this mastery. We have so much more to live for, but it takes a little bit of work.
yeah, and commitment. Thank you. I'm thinking about sort of other silos that might be related. So, for example, nutrition,
Mhm.
supplements, do those things play a role? I think we know that they do, but how should we sort of be looking at nutrition, for example?
Yeah, so you know what, our bodies are wondrously made, and they work together so well. Um, but there are changes over time, and nutrition and the microbiome is one of them. Our microbiome, due to all the influences what we've eaten in the first 40 years, due to pesticides, due to changes in the age of our GI system, our microbiome changes and has different needs. And so from a very basic standpoint, I prescribe anti-inflammatory nutrition. The principal tenet is we must stop eating simple refined sugar.
Yeah.
Sugar will bake us from the inside out. It makes us highly inflamed. It's going to make us add adipose tissue to adipose tissue, which we do not want. And simple refined sugar includes simple carbs like white bread, white pasta, white rice. And people always ask me, okay, 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 I can give up adding white sugar? What about agave? Or what
Mm.
about honey? Or what about fruit juice? Well, where do you think simple white sugar comes from? Beets and sugar cane. They're vegetables, right? So agave, honey are the same sugar source. It's just in a different form. I am not against carbs, but we must take our carbs as fiber. Our gut microbiome needs fiber, 30 grams. So high fiber, high protein, 1 gram of protein per ideal pound. Not what you weigh, but what you would ideally want to weigh. And maybe you weigh what you want to ideally weigh, but 1 gram per ideal pound to fuel the muscle building that you're building, right? Um, and then from a supplement standpoint, you could take 900 supplements. I'd rather you get what you need from whole foods. Um, but we already talked about vitamin D with K2 for absorption, magnesium. Omega-3s are great for brain health if you can tolerate the fishiness of it all. Um, we need fiber. Sometimes you need to take fiber supplements. Sometimes that makes you bloated. Sometimes you can tolerate it to get up to 25 or 30 grams of fiber a day. And then there are many other things. But again, I think maybe we were talking before we got on, but oftentimes many people want to jump to the biohacking things before they've really optimized their health. I would rather let's get our ducks in a row from a health standpoint, and then we can add in all the fancy things that we read about that have been tested in rats and not humans.
Yeah. Dr. Wright, what about calcium? We hear about calcium a lot in midlife.
I would rather you get your calcium from food. It's
Okay.
hard to eat enough to get 1200, 800 milligrams. So I'm not opposed to a good calcium supplement, but not as the only source. You
Yep.
must eat enough green leafy cruciferous vegetables, high calcium foods like sardines even. I hate sardines, but to get calcium from your diet, and then if you still need to supplement, you can do that.
I saw some questions about, and I can't find them now, so I'm going to do my best to repeat. Is it biophosphonates?
The
That
bisphosphonates.
bisphosphonates? What is that? And is it helpful?
Yeah, bisphosphonates are medications meant to help rebuild bone once you're osteoporotic.
Okay.
Yeah. And so, when you have reached the diagnosis of osteoporosis, which is a DEXA score of minus 2.5, we the unit of a DEXA scan is a T score. It's actually just a measure of what your bones are doing measured against a healthy 30-year-old's bones. A T score of minus 2.5 or below is considered osteoporotic, and that's the point where you can consider using pharmacology to increase your bones. And bisphosphonates is one of those. There's an emerging field of more and more options for medical intervention for osteoporosis, but it doesn't negate the need for all the lifestyle things we've already talked about.
Yeah. I think, the more of these kind of conversations I have, and there is like and it women enter into the conversation new every day. So it never gets old, but there is this thread sort of woven through, which is dialing into sort of the basics, right? Moving your body, eating the right food. Like you're all sort of saying the same things on repeat, the role of hormone therapy, sort of simplifying everything before you look out and out and out. So I appreciate your repeating. You mentioned the DEXA scan. Are there any other screenings that women should be getting aware of in their 40s, maybe?
General health?
Any
Yeah.
related to bone, general health?
Oh, related to bone, DEXA scan is the standard. I would love women to get a body composition DEXA scan, or some gyms have something called an in-body. I think it's important to know how much muscle and how much fat we have. You can't know where you're going unless you know where you are, and those can be easily purchased. Um, And it is a cost, I get it, but you can pay for it with your health savings account. You can save up your Starbucks money for a month and purchase those for yourself. So DEXA scan, body composition, of course. Every woman needs a breast exam, whether you get that, well, monthly self breast exams, but whether you get with that with a diagnostic mammography, or if you have dense breasts with a ultrasound or even an MRI, that's critical. Women over 45 need to have a colonoscopy to look for polyps and other forms of badness. And, fiber goes a long way. 30 grams of fiber is important for that. And then I also think that the first time to meet your doctor is not when you're sick. I think
Absolutely.
you have to have a relationship with someone who can care and prescribe for you. And by meeting those people when you're not sick, it gives you the opportunity to interview them. See if you align on how you want to approach your health. See if they listen to you. When you seek a doctor-patient relationship when you're well, it gives you the luxury of time versus showing up for the first time when you're just feeling like a disaster and just need a prescription, for instance.
Thank you. Someone says, she asks, I'm hypermobile and very worried about it getting worse as I age and go into menopause. Do you have knowledge of hypermobility and how to prevent further pain?
Well, hypermobility is a spectrum. What it means is that your collagen is stretchy, like Gumby. If people are old enough out there to remember that little green guy, Gumby,
Mhm.
you're just super stretchy. Now, that can just be super stretchy, or that can be diagnosable collagen disorders such as Ehlers-Danlos, which can be life-threatening. So I encourage, if you're really hypermobile and um, get a diagnosis. If you're just super stretchy because you were a dancer or something, that's something else. What we find, or what I have observed in people with diagnosable collagen disorders like Ehlers-Danlos, is that it actually seems to get worse at puberty. People
Hmm.
will be fine when they're little, and then as estrogen comes on board, which lubricates everything, it progresses. What I don't know is if it gets better once you lose your estrogen.
Okay.
But what I do know is that for hypermobile people, it's even more critical to maintain muscle mass in a safe way to support your joints.
Terrific. Um, I'm seeing a few questions about PRP that you mentioned it a few times. I know. Can you speak about it a little bit more? Sort of what is it? What happens? What does it do for us?
Platelet-rich plasma is one of the orthobiologics. It's one of the ways that we harness your own power to heal yourself. So in your blood, we have many particles. It's not just red fluid. It's filled with particles and proteins. It's a pathway. It's a fluid pathway. One of the particles is called a platelet, which essentially is just a sac, a membrane filled with growth factors, and it's a little sticky. So when you cut your leg shaving and you bleed a little bit, it stops bleeding because platelets will have piled on to the hole and plugged it. But it's not just bricks in a wall, it's not just a plug. The platelets then rupture, releasing all the growth factors your body makes to heal yourself. And this, when you cut your leg, your skin heals. Well, we harness that ability by using your platelets in places you need it. So what we do is this is my current protocol. We draw 120 cc's of whole blood from your antecubital vein here in your arm. We put it in a centrifuge, and because each of these little particles weighs a different amount, they settle out of your blood in layers. So we are capable of pulling the platelet layer out separate from the white blood cells, separate from the red blood cells. We then have 10 billion of those platelets and can use it for things like rotator cuff. We've got great data that we can help rotator cuffs with platelet-rich plasma. We can decrease inflammation of frozen shoulder. For arthritis and the pain and inflammation, if we inject it into your knee or your hip or wherever you have arthritis, we can improve your pain and function by 80%, and that can last a couple years. And so that's what platelet-rich plasma is. Usually an orthopedic surgeon or a non-operative sports doctor will be able to give that to you. And it's another non-pharmacologic modality harvesting the power of your own body.
Thank you, Dr. Wright. I know we're going to wrap up soon. There are just a few more questions I want to get to. Someone asks about women who may not have the access or means to, get into a gym or get the supplements or whatever. I think specifically she's speaking about movement in terms of examples of ways we can press 4 times, 4 sets at home. What else might be available to somebody who can't get in a gym?
Everybody has a pair of shoes they can walk in. Everybody has a flight of stairs, which is 17 steps to the next floor. Probably in most communities, there's a track with bleachers that can be used to build your butt while you walk. So that kind of community resource. YMCAs are everywhere. They are on a sliding scale of income. If you have no income, you pay virtually nothing, right? So if you are curious and explore, there are resources, number one. Number two, listen, I grew up on a farm. This farmer's carry that's so popular in gyms right now, where you're carrying kettlebells for a minute down a football field, which I just demonstrated the other day on my Instagram page, is a real thing on a farm. But it's not kettlebells, it's buckets of water or it's sacks of grain or so. So I challenge people that it doesn't take fancy iron or a sleek workout outfit to find something to lift. So at home, if you want to bench press your 40-year-old 40-pound toddler, or bench press some heavy sack of I'm making this up. I've got a sack of topsoil in my garage right now. The bag of salt that you put in your water conditioner. Just look around your environment. A stack of books. It's probably not going to be 40 pounds, but a stack of books. My mother, my 84-year-old mother, her heavy is different than my heavy, right? I saw her walking around our pool. We live in Florida. Everybody's got a pool. It's not a big deal here. Doing this with her arms. I'm like, what has she got in her hands? My innovative mother had gotten big cans of Campbell's soup because it's all she could find in my house. And she was biceps curling this soup. So I went out and I bought her some 4 and 5 pound weights, and that's what she does now. But that kind of innovation is exactly what you need.
Thank you. Somebody commented here, is it possible to clone Vonda? One for every community, please. Your insights and wisdom are wanted all
Isn't that
over.
Oh, isn't that sweet? Well, you know what? I am on Instagram every single day. It's like
Yes,
having
you are. You are. Last question here. What are your recommendations when one gets injured as a result of lifting heavy weights, i.e. a pinched nerve, elbow joint pain, and so on? Can you speak to that? You mentioned earlier, as it relates to frozen shoulder, sort of not wanting the stiffness or the immobility to set in. But what about the rest of the
Yeah,
body?
I think it's important to realize that when you sit around, you atrophy. So the advice, if you ever get it when you're injured, just to sit there and rest for 3 weeks, that's bad advice actually, because if you injure your right elbow, you still have an entire left arm, a core, and 2 legs. So you keep those moving. For the injured part itself, um, you can rest for a few days, but I would seek care sooner than later. And then when you're feeling better, I would ask yourself, why did it happen in the first place? Is it because my form got sloppy?
Hmm.
Is it because I did too much too soon, too often? Right? We can't go from 0 to 100 miles
Right.
overnight. There are reasons we get injured, and it usually has to do with the form we're using and how fast we try to progress.
Thanks. I just want to encourage those of you who asked questions specific about HRT or MHT, to take advantage, go to our website, myalloy.com, and connect with a menopause specialist who can walk you through your experience, your symptoms, your options. You are not alone. You're not getting through this alone. That's what we are here for, and that's what our deep bench of doctors can speak to specifically. Lastly, Dr. Wright, is there a message you want to leave us with? Something that I didn't cover? I think you got into just about everything this
Yeah.
out, but anything I missed?
You have some great questions. Well, number one, really, this is a bit of an advertisement. I really am on Instagram every day. So the more you
Yes.
these same things, I say them about once a month. I circle through realizing that there's a lot of new people. So educate yourself. It's part of self-education. Number two is please take to heart the thing I said so powerfully, and that we are not victims of the passage of time. We are not victims of suddenly turning 40, 50, 60. We need to pivot our mindset so that we can make these years the best of our lives. And here's the really last message. The reason to do that is because you're worth it. You are worth the daily investment in your own health.
Dr. Vonda Wright, you are such a pleasure. Thank you for your work and your advocacy and your encouragement and your research and your science and your enthusiasm. You're really just a phenomenal educator and inspiration. And thank you for coming here and speaking with us again on the platform. And I hope that we see you again soon. You will see us soon. You're seeing us in November.
In November at our
Tell us
summit,
about
where
that event.
Alloy is a lead sponsor. So every year I do 4 big events, and Alloy has been with me on this journey. We do 3 retreats called Midlife Mastery, where you learn all the things you need to learn about midlife, including menopause and HRT, and we equip you to take action. So you should be looking for those announcements. We're doing one next year in February, May, October. And then in November, this is what you're talking about, Rachel, November 8th and 9th, we have just sold out of our inaugural Orlando Women's Health Conversation Summit, where we have brought some of the country's best women's health speakers and advocates in one place so that you can really step in front of what you need to know in midlife. And we're so proud that Alloy once again has come alongside us as one of our lead sponsors, because it just shows how much you value the health of women, because you don't have to go out and sponsor these extra things, because I know you're really busy. Your doctors are so busy right now. But I think when you do that kind of thing, it just shows your commitment to the health of women and the future that we have in this country.
Yeah, thank you. We certainly are, and look for much more than in 2025 from Dr. Vonda Wright. Consider this time to get sort of dialed in on your rhythm of moving and bouncing and eating well and getting enough sleep, and as you say, looking at making a decision about your MHT, and so on, and be ready for next year. There's going to be a lot more of Dr. Vonda Wright, and I'm sure us as well. So thank you again. Thank you everybody for coming, and we'll see you soon.
Bye now.